Bismillah ar-Rahman ar-Rahim. Our case today is very interesting. This baby is 25 days old boy, presented with history of fever and respiratory distress. Clinical examination: the baby is tachypneic, distressed, require non-invasive ventilations. FI2 oxygen requirement is reached to 30% to maintain the saturation above 90%. Chest examination: diminished air entry bilateral and hemodynamically stable. Blood pressure and other vital signs is stable apart from respiratory rate is 65. What is the assessment at that time? This is late onset neonatal sepsis, bronchitis, bronchopneumonia. What is the plan? Septic workup taken and started antibiotic, ampicillin and oxacillin, and respiratory support, non-invasive ventilation, high flow nasal cannula, 2 liter FI2 oxygen 30%, and X-ray taken and blood gas. And also we request for RSV and viral study. And after X-ray, as you see here, this is the key point for our case. If you will see elevation of the dome of the diaphragm or elevation of the hemi-diaphragm on the right side. This is the key point or the message from the case, the elevation of the diaphragm on the right side. This indicates eventration of the diaphragm and can be diaphragmatic hernia. But since the continuity of the diaphragm is intact and no bowel, you see here, no bowel loops in the chest, so we can exclude diaphragmatic hernia. So what is the definition of the diaphragmatic eventation? Elevation of the dome of the diaphragm or the diaphragm or the hemi-diaphragm with intact and intact continuity of the diaphragm. There is intact diaphragm and the continuity of the diaphragm within normal. This is the definition. What is the cause of the diaphragmatic eventurations? Either congenital or acquired. Congenital, it will be developmental disorder of the diaphragm or the muscle of the diaphragm. Acquire, atrophy of the diaphragmatic muscle. Atrophy of the diaphragmatic muscle can be also infection, traumatic injury, phrenic nerve injury, can be also hypoplasia of the homolateral lung. This is the causes of diaphragmatic eventation. Congenital developmental disorder or acquire due to atrophy of diaphragm or infection, phrenic nerve injury, or the muscle of the diaphragm injury, or hypoplasia of the homolateral lung. So this is the cause. How to diagnose? I have to do chest X-ray. As you see here, the chest X-ray, it will give you clue about elevation of the dome of the diaphragm with intact continuity. If there is defect in the continuity and there is bowel loop, this is congenital diaphragmatic hernia, and you have to do lateral X-ray also. And if you need to confirm more, you have to do ultrasound or CT and fluoroscopy. Fluoroscopy for diagnosis also, it will help. It will be abnormal diaphragmatic movement or paradoxical movement of the diaphragm during respiration with mediastinal shift. So this is the diagnosis: chest X-ray, ultrasound, fluoroscopy. If you would like to differentiate between the eventration or congenital diaphragmatic hernia, you have to do CT or you have to visualize it or operative visualization, open and see. This is one of the modalities of the diagnosis or to differentiate between the eventration or diaphragmatic hernia. So the time of the treatment, how to treat baby asymptomatic, will be conservative treatment. If the baby symptomatic, we have to do diaphragmatic application, the surgical treatment, diaphragmatic application, and you have to consult the pediatric surgery. So our message from the case: once the baby present with the respiratory distress and you do X-ray and you see the dome of the diaphragm is elevated, you have to think about diaphragmatic eventation or congenital diaphragmatic hernia. How to differentiate between them? By continuity of the diaphragm. There is actually elevation and intercontinuity, this means eventation. If the continuity is affected and there is bowel loop in the chest, this means congenital diaphragmatic hernia, and you have to call the pediatric surgeon and do further investigation. This is our message from the case. Shukran. Salam alaikum.